Shall we begin, Dr. Varun? It's 5.
Yep, please.
Uh, Good evening, everyone, and welcome. Thank you for joining us today. I'm Dr. Andaleeb Zaidi. I'm a prosthodontist, founder of Tech Dentist, and I'm passionate about helping dentists make informed decisions about their careers and future opportunities. Thank you all for taking the time today, and thank you, Dr. Varun, for sharing your journey with us and helping others also to achieve their dreams in Canada. Please, I would like you to introduce yourselves. It will be much better than what I can say about you, and we can begin the webinar. Thank you so much.
Thank you, Dr. Zeddy. Thank you for the opportunity and thank you for giving this platform to share my experience with everyone. I'm Dr. Varun Singh. I'm an orthodontist, board certified Canadian orthodontist, practicing in Mississauga, Ontario, Canada. So I did my dental school and orthodontics from back home in India, and then I've been on the move. So I stayed in Nepal for a couple of years, followed by Abu Dhabi, finally moving to Canada. And I end up doing my specialty training through the dental specialty assessment and training program and have been practicing since then. Last year, I started my own practice, and I'm very happy to be here sharing my experience with everyone.
Thank you, Dr. Varun. And it has been an incredible journey for you because getting into DSATP is no small feat because there is only limited number of seats and only in two universities, in University of British Columbia and Toronto. So being one in a million, I would say to get into that and get your specialization in orthodontics again in Canada is no small feat. So thank you so much for doing that.
Thank you. Thank you.
You can begin your
Yeah,
presentation.
yeah, sure. I want to make sure, is everything visible to everyone? Like
Yes.
Dr. Zaidi, is it? Yeah, perfect. Yep. So I already gave a brief introduction, but just to let people know. So I practice in Mississauga, Ontario. I'm an orthodontist. I did the specialty assessment training program at the University of British Columbia. I had some academic experience from my previous journey in Nepal and Abu Dhabi. Currently, I'm also mentoring international dentists through Windmill Microlending Community, where they provide financial support for international dental professionals. And I'm also a mentor for IEHP program, which is again for all the healthcare professionals seeking recertification in Canada. I'm also open to helping others, and this is my email and website, and we will talk about this. So, as I discussed, there are different programs for healthcare, internationally trained healthcare professionals, internationally trained dentists, and these are the means by which you can get some good help. So Windmill is something which provides loan to internationally trained dentists at a good interest rate, and they have different programs which you can find on their website. So I've been mentoring on their mentorship program, and same is true for IEHP, which is also a similar program, not restricted to dentists but other healthcare professionals. Now, what we will all cover today is first is just a brief overview on why Canada, what are the opportunities, what you can expect, why immigration is important, and what are the different pathways for dentists. For international trained specialists, what are the pathways, then what are the other traditional pathways, and some new pathways which have recently opened up. So always people ask this question, like, why Canada? What kind of opportunity? So I would say the number of dentists, yes, there are a lot of dentists licensed in Canada, close to 23,000, but awareness is also very high. So as you can see from these statistics, based from Statistics Canada, 30 million plus Canadians visit a dentist annually. So there is high utilization, awareness, plus the government is also funding dental care for the population. So there are government plans to ensure that there are no barriers to care. Now, in terms of compensation, this is again not a I would say there's always a range, right, for people working part-time, full-time, doing various things. So this is just an idea of what you can expect as a dentist. But to me, I feel this is slightly on the lower side of the spectrum is what these statistics are showing you. Now, in terms of occupation code, dentists do come under targeted healthcare express entry draws. There is this NOC code for dentists. So, step one, what I would recommend to anyone is try to get your Canadian PR. Things open up a lot. Opportunities also open up a lot if you have Canadian PR while you are in this process. So now, what are the different pathways? The straightforward pathway is express entry, where you have a healthcare category. So you need to have 6 months of continuous experience in last 3 years, and this significantly, lowers the score for you in this pathway. As you can see, for general it is 524 or 525 plus. This pathway would bring close to 450 for you. Now, definitely, there are language requirements with different English language tests. So, in terms of timeline, once you get the uh, invitation to apply, which is also known as ITA, then the whole process it typically takes around a year to finish. Now, you don't need any job offers to apply for express entry, and you can start the process simultaneously. You can start your NDB profile at the same time. Now, there are other pathways like a provincial nomination program. So, because of various factors, because of your age or English language score, if you're not getting a good score in express entry, you can always explore these other pathways. They would add significant points uh, to make sure that you get shortlisted. So every province has their own pathway. Ontario, BC, Alberta, Atlantic provinces, and faster processing definitely in underserved and rural areas, which would make sense. I can, provide more details on specific pathways, especially in Ontario. Now, the third option is if you're doing direct licensing and, you would want the PR status at the end, you can obviously do that with direct licensing and all the exams. And then as a dentist, it's relatively easy to get a work permit. And then you work as a dentist. If you study for a qualifying program or your work experience would qualify you extra points, which would make it easy under Canadian experience class. So there are a lot of people doing all the routes actually. It depends on your specific situation. Now, coming to options or different pathways. So again, different pathways for different people wanting different things. For specialists who want to qualify as a specialist in the least amount of time, the pathway is Dental Specialty Assessment and Training Program. Now, this pathway has changed a lot over last couple of years. So when I applied, there was a different exam. Now there is a different exam. The duration is almost the same. It is one of the difficult pathways because, as Dr. Zaidi mentioned, the number of seats are very limited and they are not constant. Like every year, some university might offer some seats in some specialties, and you might have to wait 2 years sometimes before that seat opens up again. So it's not something which is very predictable. But see, it's not impossible. I took this route and I can guide you, and I successfully completed this pathway. The second pathway, which is the most common pathway, is the equivalency process. So you have to write three series of exams followed by the exams which Canadian graduates are also writing. So here what happens is you write to the National Dental Examining Board of Canada, you create a profile, they do the credential verification, and then you register for exams. The first exam is fundamental knowledge, followed by clinical judgment, and the last exam is a clinical competence exam, which has again two components, situational judgment and the skill exam. So once you get to all that, you finally write the OSCE and written exam to get the license. The last pathway, not the least, is a university-based option where, again, you should have a qualifying exam. Now, most of the schools are asking for American Dental ADAT or American Dental Admission Test, and then you do the qualifying degree program, which is 2 to 3 years. Now, it's mostly 3 years in most of the Canadian universities. Once you finish your advanced standing or qualifying program, then you get to write with other Canadian graduates, NDB written in OSCE, finally getting to the license pathway. Now, one thing important here is this university route would give you full credentials and give you the ability to move anywhere in North America. So once you have a DDS, it's mutually recognized in the states. So because CODA, which is Commission on Dental Accreditation in US, has a mutual treaty of recognition with Canadian Dental Accreditation. So your degree is recognized in North America. With the equivalency pathway, there are limitations to where you can practice. You can obviously practice in Canada in any of the province, but in the States, you might have to check with the boards. And with the first pathway, you can only practice in Canada. Now, coming to the first pathway, which is the specialist routes. So, dental specialty assessment and training program is designed for internationally trained specialists, and it is the program is divided into two phases. So it's typically a 12-month program. The first 3 months is an assessment phase. So they would try to see what you are good at according to the Canadian standards and where they need to bridge any gaps in your training. So that is training which is up to 9 months. Now, this is entirely clinical. You would be, getting patients from day one, and this is, again, it depends on the program director. If they feel that you are competent, you can go ahead. If not, then you might be dismissed. Now, Canadian PR or citizenship is required for the application, right? Now we will go into a little bit about the key requirements. So this is definitely for international specialists who are applying. Again, you have to check with the NDEB regarding what is the taxonomy or the classification of your degree with terms to Canadian qualifications. There has to be a match. I will explain that in later slides. In terms of requirements, you definitely need a language assessment, English proficiency exam, and then you have to take a qualifying exam. Before, it used to be dental specialty core knowledge exam. Now everybody is accepting the ADAT exam. Apart from that, definitely your CV highlighting your unique credentials, any achievements. If you have a good research profile, that would definitely help you stand out, and all your clinical experience, letter of intent, statement of purpose, reference letters, etc., is all what is needed for the application. Now, there are universities offering this dental specialty and assessment program, and as Dr. Zaidi correctly mentioned, University of British Columbia and University of Toronto offer this program on a regular basis. So these are only two universities. Other universities, like they offer, like for example, they offer this year and they may not offer anything for 2 years, 3 years. For example, Alberta, they recently started last year. The program was not accepting applications for 3 or 4 years in between. Same thing is true for Manitoba. Even in British Columbia and Toronto, sometimes some specialties are not covered in each cycle. So you might have to wait before a position available in the specific university, which is very important to consider. Now, in terms of application is very straightforward. You registered with the NDEB. There are some documents which needs to be verified from your university. So again, credential verification, and it takes time. So you have to be patient in this process. It might take 6 months, 7 months. It is a time-consuming process, right? So they would ask for a degree completion form to be sent directly from the university, official academic record and transcript, etc. And these requirements, keep changing. So you have to follow what is in the website for the latest information. Now they do ask you some documents from you. There is a checklist of self-evaluation checklist for your specialties. There is an application fee involved there, a proof of your Canadian status, citizenship, or PR, and then all the other your academic documents, including English proficiency test scores, is what is required to start the process. Now, this is the most important thing when you're applying for this, because many qualified specialists don't understand the difference with what this process entails. So there is a requirement. Your program should be of minimum 22 months full-time duration. Like it's 24, 22, because some American programs are 22. So 22. So again, the problem comes in, like, for example, in oral and maxillofacial, the program should be minimum 48 months full time, because here it's like a combined medical and a maxillofacial degree. So it's 4 to 6 years in Canada and the States. So most of the maxillofacial surgeon who have done any degree which is less than 4 consecutive academic years don't qualify for this. Again, oral radiology is a separate specialty. Like example, for if I compare from back home, it's oral medicine and radiology. So here radiology is a separate specialty. And then they require at least 3 consecutive years in only radiology. So oral medicine here is again a separate specialty. Sometimes it's combined with oral pathology. So oral pathology and oral medicine. But so then again, so if you have done any of these, you might not qualify for this program. Same thing is true for conservative dentistry and endodontics, because here it is endodontics. So you have to confirm with NDEB all these things pertaining to your specialty, whether it is a match or not. Now coming to the equivalency process for general dentists. Now, people don't consider the amount of time it takes, right? Step zero, where you're not doing anything, you're just applying to create a profile, and they do credential verification. It takes time. It's a time consuming process. So I think it's very important you should do these two processes at the same time when you are thinking about your PR. Now, there are 3 sets of exams, and assessment of fundamental knowledge is the first exam. It's an MCQ based exam, just testing your fundamental dental knowledge. And you must pass one exam before proceeding to the next. So there's a sequence, of course. And there are exam fees involved, which I have highlighted. Again, fees are subjected to revision every year. So always confirm everything with the NDEB. What I would say here is, first 2 exams, it is very much possible to do the exams even if you are not moving to Canada. Like you can study, you can take online courses. Most of the courses are online, but for the clinical exam, you have to come here and practice, and then only it's possible. So the third exam is the most rigorous exam and requires a clinical practice and training at a facility. So again, for first exam, second exam, there is a number of attempts. Like if you can see, maximum 3 attempts allowed. For the clinical exam, unlimited attempts. There are no number of attempts. Before it used to be 3, but now there are unlimited attempts there. The exam has 2 components: situational and clinical component. And the exam is very it's very strict, and it's a challenging exam, if not impossible. So after equivalency, again, you're not done with exams. You think that after 3 exams, you're done with exams, but then you have to write a certification exam, which all the Canadian dentists have to write as well. So again, 2 components, written exam and the OSCE component. The pass rate in these exams is very high. It's around 97-98%. So if you clear those 3 exams, this would not be a major hurdle, is what I would say. Then we come to licensure. Now, every college, like back home, there is dental council of every state. Here you have colleges of every province. So you would apply to the college where you would like to practice, and then they might do, they might ask for good standing certificates from back home. They might do a criminal background check. They have their own ethics and jurisprudence exam. So they have their own things, which takes time. So I would say once you're done with exams, you're not done. It might take another 3 to 6 months before you get your license. So you have to be aware of the total time it takes before you get to practice. Now, something new, because something new came up in 2025, which is called Bridging Training to Dental Practice in Canada. Now, why I've kept this before the university option? Because it's a shorter option. So suppose you're doing the exams and you did the fundamental knowledge and clinical judgment exam. And now the third exam, which is the clinical and situational judgment, you're finding it difficult and you would want to instead go to the university to practice everything and be clinically competent to practice in Canada. So this is an 8-month compressed bridging training program, but remember, it's not a degree program. It would just give you credentials to practice in Canada. The advantages are this is an accredited program, so you get to skip the last clinical exam or the NDCC, and you can directly go to the OSCE part, which is a big thing, right? And then you go to these universities. There were 3 sites last year, which is University of Alberta, Dalhousie University, and University of Laval. Again, Laval is a French program. So for people in English, there were only 2 options. The good thing is you get to finish the program in 8 months. The fees is significantly less, and you can start practicing after writing the written and OSCE part. So again, the requirements are English language assessment. You must have passed the first 2 component. Now you must be a citizen or PR, and then there is a full process. They do exams, they do interviews, and then they even do a clinical bench test exam. So the exam, the process is very extensive. Now there is a limited program which is in Alberta. Now this is a different program. This would not give you a full license to practice, but this would give you a limited license. So it is a good program for people who would like to earn while they are doing the process. So this gives you a license so that you can do some reversible dental procedures under the supervision of a dentist. So you can work with a dentist, you can earn during this period so that you can have good financial resources to pay for all your exam fees and living expenses. And this gives you hands-on training. You're working with a dentist, which is a good thing. But unfortunately, this is only in Alberta. Again, the requirements are Canadian PR or Canadian citizenship is something which is very important. Now, direct path to this is the one which people don't speak about. This is direct path to dental residency in Canada. So people often ask, we are a dentist from back home. Why would I go back and study dentistry? Can't I study specialty directly? So the answer is yes, you can, but it is totally different from applying for the equivalency process, because here for specialty, the process is totally different. Again, you have to get your credentials verified. You have to have your English language assessment scores, and then you have to have a good CV or resume with a good research profile, publications, and you have to do a good letter of intent or statement of purpose, references, some work experience or observership experience locally that would add to everything. And then you can apply for these specialty programs. Now, these programs are typically 3 years, depending on 2 years, 3 years. Like maxillofacial surgery is definitely 4 to 6 years, but like 2 to 3 years. And they would give you a specialty license. So you would not get a general license, but you'd get a restricted specialty license, and you can practice specialty in Canada and some states in the US. So this would bypass the dental specialty assessment and training program entirely. And in my opinion, it's a better choice because this gives you, again, freedom to move to some of the US states, if not all. And this is a full program. So again, it depends on your goal, and it's competitive. It's difficult to get in. So you have to prepare for this pathway. Now, the other option is for people who are very interested in research, like and academics. So they have this option. You can do your MSc, which is Masters in Science in Dental Sciences, It's a research-based program unrelated to clinical licensure. So you don't worry about clinical license. You just do your MSc, research-based MSc, and then you can do your PhD research-based now. For MSc, there is a tuition involved. Sometimes there are paid positions or there is funding available. For PhD, there is a chance that you'd get funding in most of the cases. Now, the process is you get enrolled in MSc, finish your MSc, find a supervisor who is in the same page as you in terms of your research goals, and then do a PhD, because a lot of these supervisors have their own labs and federal funding for research projects where you can get PhD opportunities. Again, there are requirements in terms of GPA, in terms of your English language assessment, and obviously credential verification. But again, this is a route which most of the people don't take. But again, it requires interest in academics, and then you are not thinking about clinical practice. Obviously, you can do your exams later, but this is mainly for people who want to go in research and academics. So this is very much possible. Uh, just look at all the pathways. Why I made this chart is to show you PR requirements. See, you don't need a PR for the equivalency process. You don't need a PR for a MSc or PhD research, but it is better to have a PR. It is better to have a PR because it would open doors for all the options. It is very easy for any loans if you are a PR or if you are a citizen. Your fees are different. So if you apply as an international student, your fees are on a higher side for specialities if you're applying for a specialty program as compared to if you're a PR or a permanent resident. So that is to be taken into consideration. And other than that, it also gives you ease of movement. Like you can come into Canada whenever you want, instead of if you have a temporary visit visa or something which is not very permanent. Now, looking at the last but the not least option is qualifying programs. So most of the programs now require ADAT, which is the exam which you need to qualify, score in order to apply for these exams. You definitely need English language assessment for everything, and PR or citizenship is required. So this is something important. Most of these programs are now going towards 3 years. There was a time when everything was 2 years, but now it's almost going to 3 years. I think except University of Saskatchewan, which is still 2 years, everything else is 2.5, 3 years. So you go into second year or third year of DDS, and you have to then finish the remaining 2.5 years there. Now there is fee involved. There are annual fees, and then your living expenses. So financing is easy if you are a PR, because you can only apply if you are a PR or resident. You get a line of credit from the banks, which is a very straightforward, easy process. You get a non-secured line of credit. You don't need any guarantor. You just need an admission letter, and it's a very straightforward process. So this is the advantage with this program is you can go practice anywhere in North America. It gives you the freedom of movement in the states, all the provinces, and in Canada, of course. Now, if you are thinking of applying to a equivalency process, then it's you just prepare for the exams. But if you're thinking of keeping your options open and applying to a residency program, or thinking about advanced standing program for DDS, I would say work on your CV. So publications, awards, whatever you have done, even community work or social outreach, like you've taken participation, you have participated in camps, or worked for underserved population, everything should be incorporated in your CV. If you have helped in research projects, okay. If you have not published research projects, that's totally fine. But if you have even helped or assisted in any of the research projects or publications, that is also equally important. Try to do observership experience that helps greatly, or a volunteer experience in hospital settings, ideally dental settings in North America. So that would also adds to your resume and your overall application. Now, every exam is different, every pathway is different. So please be very specific. I think it's better to choose something and then work towards it rather than trying for everything, because there's a lot of cost involved, you know, a lot of resources. So I would say be very specific to what you want to do and just focus on one or two pathways. Keep always a backup, but like don't just try for everything. Now, if you're applying for a residency program or advanced studying program, sometimes they ask for a statement of purpose, which you have to do very sincerely. Don't take this lightly. This is one of the most important things which is going to screen your application. Then your letter of reference. Ideally, if you can get a letter of reference from somebody in North America or somebody from a school here where you're applying, that is a big boon. Uh, so that is why that local experience, observership, and all these things count. Um, or somebody who can comment on your clinical or academic work. Now, again, interview preparations, if you're applying for a DDS program or if you're applying for the bridging program or residencies, interviews are very important. So how to excel at these interviews, right? So you have to, do attend some of the coaching programs or some of the online programs where they would teach you what is expected in these interviews, right? How to crack these interviews. So you have to also understand Canadian healthcare systems, and you have to make sure that you excel at some of these behavioral questions, right? So it's all about preparation. And then obviously, don't scare to be, with the technology. Always, make sure that you are aware of the latest digital and technological advancement in the space. So this is highly valued by Canadian programs. With that, I thank you all for your patient listening. And, it's always one step at a time. Uh, what I would say is choose your pathway and then start working towards it. And you need to be patient. It is not going to happen in 6 months, 5 months. It would take time. Sometimes it may take years, 3 years, 4 years. But you have to be, you know, very practical when it comes to how much time it would take, what you need to do, and it's about working hard. Thank
Thank you,
you.
Dr. Varun. It was a very comprehensive overview of everything that is Canada for dentists. So, Dr. Varun, I would like to ask a question like, what was the biggest culture shock in Canada that you received when you moved there?
So there were a lot of things, like in terms of what I would say is Canadian etiquettes. So the real emphasis is listening to the patient. So there's a lot of listening. Plus, there's a lot of documentation. So they are very high on documenting everything. There is a specific way you write your notes. Informed consent is something very different. Canada is very diverse. It is multicultural. So you have to have, a good understanding of different cultures, backgrounds. People are coming from everywhere, right? So yes, yeah.
So, Dr. Varun, like it is being said that even Canada is very saturated for dentists today. So, in 2026, like any pathway, whichever you choose, it is a difficult way, and you have to commit for at least 3 to 5 years before you get your licensure there. So, is it still worth it coming there?
Yeah, I would say still worth it. I agree. There is some saturation, but as you can see, the awareness is really high. And the government is supporting by providing all these programs so that people don't have to spend out of pocket if they cannot afford it. The government is helping them affording dental care. And I do agree, yes, places like Toronto, Vancouver, Calgary, they are saturated. But then there are places where the requirement is still very high. There are rural and underserved areas where there is a lot of opportunity.
So, Dr. Varun will take some questions from our audience. Like if they have any questions that they would like to ask, they can unmute themselves and ask the question, or type in the chat, and we will ask Dr. Varun. Dr. Varun, I had a question. Like you talked about reference letters. So, is it necessary that we take reference letter from the person that we are working with, or like if I'm in Saudi right now and you are in Canada, so can I ask you to refer for me? Give me a
No,
reference.
it depends on how you know that person, because that person has to comment about you. So if you have worked with me, I can comment on your clinical work. If you were my student back in the school, I can say she was a very bright student, right? So that is a big impact as compared to taking it from someone who's not related, right? Because then there's limited to what he or she can write for you. So if it is very strong, something from your program director, I think that would make more sense. Or if you have done some clinical observership, or if you were working for someone as internationally trained dentist, definitely they can comment more on you.
We got a question from Dr. Saurav.
Yeah.
Can we give AFK and ACJ from India?
No, you, because see, there are overseas centers, but in my knowledge, according to my knowledge, there's nothing in India. So you would have to still apply for the profile, do the exams. You can, yeah, you can stay in India and come for the exams, but you need a visa. You need to, you need to have all your documents, and you can come and write the exam. I know a lot of people who are in India and they have finished their first two exams, and they just came to Canada for the exam. There are overseas centers also. In my time, there was a center in Hong Kong. There used to be a center in UK, Australia, New Zealand, in the States. So you have to check where are these overseas centers if you cannot come to Canada for the exams.
I think they're only in Australia and New Zealand. I had checked the
No.
NDEB website. They're
Yes.
only in Australia and New Zealand. So you can take a visit visa from India and go and give the exam there.
The exams.
And like, what would you say is the best pathway for a dentist? Like they're starting now in
Yeah.
20.
So, yeah, it depends on your interest too, right? If you are interested in practicing as a general dentist, if you want to practice as a general dentist, and if you have good clinical experience, so then you can take the equivalency pathway, right? Because then, you have clinical experience, you have all the skills, you just need your license to practice in Canada. If Canada is not your final destination, if you're thinking about moving to the States, or if you want to, go back to dentistry, go back to school to learn more, or if you have less clinical experience, you are a recent grad and you would like to learn more, then university programs are the best, because then your certification is full. You can go practice anywhere in North America, plus you're going back to school. So you are learning how Canadian dentists, study things. So you're learning with them, and you have these relationships in the school with faculty members, with your colleagues, friends, networking with somebody who is in a Canadian, dental space. So that is very important.
So how much money and time like someone should realistically budget before moving?
Yeah, that's a very good question. So again, it depends. So one thing which I would say is you have to work here. So sometimes people think that they can get money from home and use that money to prepare. It is not possible. Uh, it's definitely the cost of living is on the higher side, and you have to work here if you want to stay in the country. It is another thing to stay back home, just come for the exam and go back. But if you want to come to Canada, there are various options also. You can work as a level 1 dental assistant. You can do some certifications and work as a dental assistant level 2. You can work at the front desk. You can work as a dental administration. So there are a lot of other things which you can do, but you need to work to support yourself and to pay for the exams. There are these options which I mentioned about, like windmill, where you can have a loan a loan of up to 15,000, or they have a program with CIBC where you can get a loan up to 125,000 if you are in the process. So as you clear exams, the line of credit would increase. They would add more money so that you can pay for exams. So there are ways there to support you.
So, what mistakes do you see dentists making during the licensing process?
Not focusing on one thing is what I would say, like trying everything, because now the path is so different. If you want to get into school, there's a different exam. It's no longer AFK. So if you want to
Same.
apply to residency, it's totally different, right? And if you're moving to Canada, try to work in the dental settings. This is the biggest mistake, I would say. So if you are in Canada, please go to a dental practice, do like volunteer for a week, but try to find something so that you can work in the dental healthcare setting. You understand more about the Canadian healthcare system, how dentistry is practiced here, and you learn a lot more.
Like, how are the job opportunities there? Like, realistic income that people can expect.
So again, it depends on if you want to work as an associate. Usually, people would start working as an associate. So in major cities, like I would say Toronto and Vancouver, or the Greater Toronto area or Greater Vancouver area, it is saturated. There are a lot of dentists, but if you go to rural areas or underserved areas, the opportunities and income potential is very high as compared to very urban areas, is what I would say. But yes, rural areas and underserved areas in some provinces like Saskatchewan and Manitoba, Northwest Territories, even Atlantic provinces, they are still, very open and some good opportunities.
Are there any government jobs for the dentists there? Like,
Yes, there are government jobs, but again, the compensation is less as compared to your potential in the private sector. There are uh, other jobs also, like university based jobs which you can do, but again the income potential, and then there are some restrictions on private practice to how much can you practice. So the income potential is different.
so any other questions like our audience likes to ask? So, what would you recommend for the specialist, like someone with family or already completed specialization to come? Like, do you think they should pursue specialist recognition or start as general dentist first?
Yeah, it depends. What I feel is, if you are a specialist and you are passionate about it, like, I have given it all to this specialty. I've always practiced as a specialist. Then I think it's better to pursue it. The only thing is, you should always, like with DSATP program, always keep a backup, because the program is not that predictable, as I told you. You don't know which university is going to open, and because there are only few seats, it is not impossible. Definitely, it is achievable, but there is that unpredictability around it. So yes, if you want to do the residency again, I think that's a good option. That's a very good option. And but the application is totally different when you're applying for these equivalency exams. Uh, you need to work on your CV, your interview skills, your English language skills. So it's a lot different as compared to doing the equivalency process.
Doctor, we got a question. Can dentists start working as an associate without license? How do they hire experienced dentists as an associate?
No, license is required. Like, you cannot work here without license. You can work as an assistant, or you can work in admin roles, but not as an associate dentist, right? So might take less. They might only take 4 5. So nothing is for sure. But yes, I would say it's a good program if you are into that pathway, and even if you're not successful in your the skill exam, then you at least have options because you are already in the process. See, the process is long. Like
Yes.
it's if you have done your AFK, ACJ, you are already in the process. For example, 2 years in the process, and now it's very difficult for you to go back. So it is good option for people who are already in the process. They have invested so much in the process that they have this option at least, to get something out of the process.
I think as a dental assistant, they can join directly. They don't need any other course. When doctor is asking for assistantship, what is the procedure to get dental assistantship?
So again, healthcare, so that your background is valued, and you can take advantage of your healthcare background.
I have recently heard that the Canadian government is pushing AI professionals and they are wanting to invite AI professionals in Canada right now. So I think it's a booming industry and who are really like tech oriented or they can combine both industries, healthcare and AI. It will be a really good future for them there.
Yep, absolutely. Technology is is a must. Yeah.
So if there are not any more questions, then we can wrap up.
Yep. Thank you. Thank you, Dr. Zaidi. Thank you for your time, opportunity. I thank all the participants for their patient listening, and they can contact me by email, or they can left a query on the website. I would be more than happy to help, anyone and everyone. Yeah.
And thank you, Dr. Varun. Like before we wrap up, I would like to thank each and every one of the participants and you for spending your time with us today. And I hope this session has given them a clear picture of what the Canadian journey looks like, the opportunities, challenges, and the realities that often don't get discussed openly. If you guys are interested in Canada more and if you want any other webinars, like we would like to know, like what are the topics they want the webinars on so that we can give them a more clear picture of what it is to get licensed in Canada. Thank you again for joining us, everybody, and please leave a feedback for us. Wishing you all the very best in your professional journey. Thank you and have a wonderful day.
Thank you, guys. Have a good
Dr.
one.
Varun, thank you so much.
Thank you.